Hi everyone, this is Dr. Julie Zweig with Catch Some Z's with Dr. Z. It's great to be here, and today we are going to talk about something that I see in my office a lot. It is the patient coming in with a kind of a complaint of post-nasal drip. And what they might complain of is a chronic cough or something dripping down the back of their throat, or they feel like there's a lot of mucus in the back of their throat, or they feel like food gets stuck in the back of their throat a lot. And the question is it post-nasal drip? So what we're gonna do is talk a little bit about what else it could be. So what I often find after examining the patients is that it could actually be reflux. And that is when you have acid in your stomach that comes up for one reason or another and hits the back of your vocal cords and causes some swelling, and hence you have all the same symptoms that you do with postnasal drip. Now, how do I tell which it is? Well, the first thing I have to do is I have to actually take a look in the office with a little camera that goes in your nose and then looks at the back of your throat. So in that exam, I'll actually look at your nose, and then I'll look at the back of your throat, and I'll look at your vocal cords. And I will see if there's any swelling or redness or things that actually guide me to think that it might be reflux. And then we might try to take care of the reflux and see if that helps. So what are some things that you can do to help reflux? Well, the first thing that I suggest is staying away from spicy foods and also staying away from caffeine. And caffeine can be in the form of coffee or tea or even chocolate. So we want to be careful about those things. And then alcohol, that's a big cause of reflux. So you want to be careful about alcohol. And those are my dogs, sorry. Well, it's live, what can I say? Okay, this is really funny. So anyway, whatever, life. Okay, this will probably be on the Today Show or something. So anyway, we were talking about reflux. One thing to do is to raise, I can't do this is hysterical. Raise the head of the bed up. Okay, sorry. One thing we can do is raise the head of the bed up, and also not eat 3 to 4 hours before bed. And by not eating 3 to 4 hours before bed and raising the head up, you often can handle the reflux situation just with doing those things. And also staying away from those diet things that I talked about, the coffee, tea, chocolate, spicy foods, caffeine, and oh, by the way, tomatoes, tomato sauce, and things like that. So we have to be careful about all of those things. So when in doubt, it may not be post-nasal drip, it may be reflux, and we can certainly talk about it. Now, there are some medicines that you can use for reflux, which we've talked about before, some proton pump inhibitors and things like that. But I like some more natural remedies. You can try some yogurt, you can try some apple cider vinegar, and of course with those diet changes and the head of the bed elevation, you will improve a lot. So that's it. Sorry about the dogs. Those are my two giant and there's the doorbell. Okay, great. Anyway, have a great day, and I'll try this in my office next time, which, by the way, is opening in a couple weeks. If you want more information about my practice, go to juliezweigmd.com. That's JuliezweigMD, which is MD.com. And you can find out more about my practice. I can't wait to tell you more about it, and we're opening soon. So that's Catch Some Z's with Dr. Z. Thank you. Bye-bye.